And with this, I invite our panelists for the next session, which is the state of districts. And panel being moderated by Mr. Madan Mohan, Senior Fellow, Scotch Development Foundation, former Chief General Manager, NABARD, and CEO of NABARD Consulting. Mr. Madan Mohan, over to you. Please unmute yourself.
Good afternoon, one and all. At the outset, I would like to extend a very warm welcome to all the panelists here for this session. In fact, if India is to move forward, the districts have to move fast forward, because no development can be thought of in exclusively for cities, or it has to be for the country as a whole. So I'm glad we are not only talked about cities, but we are going to talk about rural areas and the districts. So here are the change leaders we have. I find that the panel is very much learned and experienced people. They know how to make things happen at district level, and they have made it happen. Friends, we have been taking a lot of presentations and interacting with the people at district level and other at grassroots level. And we found three very glaring changes which have happened during this COVID era. I would say for the last 1 year. And I would like to start from where we left in the last session. So we were talking in terms of coordination. So friends, I have been district administrator working the last 40 years. And every time I put have not accomplished this task, they will say, sir, we have done it, but it is the other department who have not cooperated, and that is how our achievements are low. But to my surprise, now I find that whatever we have achieved during this last hour, everyone said we have done in cooperation with the other departments. So that means really the things move in a very coordinated manner and in a very cooperative way. Whether it is police department, hospital, health department, or transporting, people, labor from one place to another. So everywhere this cooperation was very much visible. So friend, the real question again it comes up is that whether we'll be able to see that this sort of cooperation continues in other fields also and on a continuous basis, and if so, how it should be done. So we like to hear from our learned panelists about this. Second thing which we observed was, see, we have been talking of technology for quite some time now, but let me tell you, things were not moving the way we wanted digitization to happen. We wanted technology to penetrate in the rural. But in a way, thanks to COVID, that way, things did move and did move with more than what we expected. It was really very speedier, and this has really helped in achieving or in implementing or in reaching the areas where otherwise physically it was not possible to reach, but technology has made it possible to reach to those areas also. And it has helped in better monitoring of our government schemes and programs. And if this is so, then the whole question is, how do we upscale it? How we take it forward? How do we take it as a system? It is embodied in our system. So this technology remains a very good issue to be deliberated upon, and that is how we have included it here. See, the other day I was taking a presentation And we were told that now there is e-learning even at the height of 17,000 feet in Ladakh. So that they have made it possible. Who has made it possible? The technology has made it possible. So I'm sure that the real question comes is how do we really upscale it and keep it as a system. Another very glaring thing which was noticed by us during this period was people's participation. See, in most of these schemes, we found that people participation was lacking all these years. We have been talking of democracy, we have been talking of democratic means and all that. But there was lack in creating awareness at the public level in general. Secondly, whatever awareness was created, there was no really use of that, because whether it is a self-help group, whether it is a joint liability group, whether it is an NGO or a voluntary agencies or even the corporate world, they had never come together like this to really focus on one issue, and which was COVID, of course. But thing is that can this type of awareness can be used for other development purpose? Can the people be really involved for bringing in the development, desired development through their participation? Because if development has to happen, it has to happen through people's participation. And some sort of true participation was visible, whether in terms of creating awareness or whether in terms of their sharing. See, I was surprised of the self-help groups which were doing some other work. They were asked to do, or they were trained to do in a very short time, to come with PPE kit or to come out with mask, and they delivered it. So I am very happy to note that now today we have a very enlightened panel, and I would request them to deliberate on this issue, these three issues, and also if there is any other issue which they think that it needs to be taken forward, we'll welcome that. And in this regard, first of all, I would like to invite Mr. Bansidhar Tiwari. He is a Vice Chairman of District Level Development Authority, Rudrapur. So over to you, Mr. Tiwari.
नमस्कार सर, पूरी टीम को मेरा नमस्कार है। हमारा जो डिस्ट्रिक्ट डेवलपमेंट अथॉरिटी है, ये जैसा कि सभी लोग जानते ही हैं, ये हमारा मैप अप्रूवल का प्लस अवैध निर्माण रोकने का, इसके अलावा सर्टेन जो डेवलपमेंट के वर्क्स किए जाते हैं, पार्किंग का या इकोनॉमिक वीकर सेक्शन के लिए फ्लैट्स बना के उनको प्रधानमंत्री आवास योजना में देने का, ये अलग अलग तरह के काम हम करते हैं। तो हमने अवार्ड के लिए अपना प्रेजेंटेशन दिया, वो हमारा ऑनलाइन मैप अप्रूवल सिस्टम का। ऑनलाइन मैप अप्रूवल सिस्टम पहले भी था, ईज ऑफ डूइंग बिजनेस जो गवर्नमेंट ऑफ इंडिया के द्वारा चलाया जाने वाला प्रोग्राम है, उसके तहत हमने ये सॉफ्टवेयर डेवलप किया था। लेकिन हमारा जो वर्तमान सॉफ्टवेयर है थोड़ा सा एडवांस है। इसमें जो ऑटो पीसीआर वर्जन है हमने इसमें लिया हुआ है। कोई मैप जब सबमिट करता है तो ये ऑटो स्क्रूटनाइज कर लेता है उसको। अगर कोई रिगार्डिंग टू बाइलाज नहीं या बाइलाज के नाम का वायलेशन हो रहा है तो सबमिशन के पहले ही डिटेक्ट कर देता है कि आप ये सही कर लीजिए, इसको करेक्ट करिए। एक बार जब मैप करेक्ट होकर सबमिट हो गया, फिर उसमें कोई गुंजाइश नहीं रहती, क्योंकि वो ऑटो स्क्रूटनाइज प्रोसेस होने के बाद ही हमारे यहाँ आता है। तो उससे क्या है कि हमारा जो पहले मैनुअल वर्क होते थे, अब सिस्टम के थ्रू होने में समय की काफी बचत हुई है और डिस्पोजल हमारा काफी बढ़ता है। दूसरा क्या है कि इसमें हर लेवल पे फाइल का मोमेंट हमें पता रहता है कि कहाँ पर इसके यहाँ कितने दिन रुकी। तो हमने डैशबोर्ड बना रखा है, वो हमारे स्तर पर उसको मॉनिटर किया जाता है, हमारे सेक्रेटरी सर भी उसको मॉनिटर करते हैं और पूरा उसका रिफ्लेक्शन होता है। तो हमारा मैप सबमिट करता है, जो हमारा एक कॉमन सिटीजन है, तो एक ओटीपी देते हैं। ओटीपी के द्वारा वो भी ट्रैक कर सकते हैं अपने मैप को, उनका इस समय मैप कहाँ पे है और उसमें यहाँ कितने दिन से रुका हुआ है। उनका एक ट्रांसपेरेंट और रिस्पॉन्सिबिलिटी बढ़ाने वाला ये सिस्टम है। इसको लागू करने के बाद हमने काफी तेजी से काम किया। कोविड में अगर हम देखें, कोविड को अगर लिंक करें तो चूंकि पेपरलेस ऑफिस की तरफ हम बढ़ रहे हैं, किसी का मैन टू मैन इंटरेक्शन इसमें है ही नहीं और बड़ा इजी ऐप है। इसका नाम भी हमने ईज ऐप दिया है। सेकंड स्टेप हम इसको मोबाइल ऐप के रूप में ले आने वाले हैं। बहुत ही हमारी वेबसाइट पे जाके कोई भी बहुत आसानी से इसका मैप सबमिट कर सकता है। कोविड में हमने इसमें काफी काम भी किया है, और पायलट प्रोजेक्ट के लिए पूरे उत्तराखंड में हमारे डिस्ट्रिक्ट को ये किया गया था। और मार्च से लेके अभी तक हम लगभग 1000 मैप इसमें ऑलरेडी सैंक्शन कर चुके हैं। पेमेंट गेटवे का भी हमने इसमें रखा हुआ है, पेमेंट भी ऑनलाइन होता है। 9 नवंबर को हमारा जो राज्य स्थापना दिवस है उत्तराखंड का, लेकिन ये बाकी अदर डिस्ट्रिक्ट्स में भी लागू कर दिया गया सेम सिस्टम। तो आज की तारीख में पूरे स्टेट में हमारा ये लागू है। जो अदर डिपार्टमेंट्स हैं, जैसे एयरपोर्ट अथॉरिटी ऑफ इंडिया है, उसको भी हमने इसमें से लिंक किया हुआ है। गवर्नमेंट डिपार्टमेंट्स जो गवर्नमेंट ऑफ इंडिया कौंसिल जो स्टेट गवर्नमेंट के हैं उनसे भी अभी हमारी प्रोसेस चल रही है, चाहे नगर निगम हो या इलेक्ट्रिसिटी बोर्ड हो या रेवेन्यू डिपार्टमेंट हो, से हमने सबको इसको लिंक किया हुआ है। इस तरह से हमारे यहाँ जब मैप सबमिट होगा तो दूसरे विभाग में भी, अदर डिपार्टमेंट्स में भी जो हमारा बेनिफिशियरी है, जो कॉमन पर्सन है, उसको जानने की जरूरत नहीं है। वो सिस्टम के थ्रू ही सारी चीजें होती है। इसमें पहले क्या होता था कि अलग अलग डिपार्टमेंट से जो नेशनल टाइम लगता है, ज्वाइंट साइट इंस्पेक्शन का हमने एक डेट हम कोई फिक्स करते हैं, सेम डेट को जितने भी डिपार्टमेंट्स हैं एक दिन ही जा करके सभी लोग एक साथ ज्वाइंट साइट इंस्पेक्शन करके और विद इन 48 आवर्स अपनी रिपोर्ट सबमिट कर देते थे, और उसके बाद फिर हम आगे की कार्रवाई इसमें करते हैं। जो हमारा जानते हैं आप सभी लोग, हिली एरिया है ज्यादातर, उसमें पहाड़ में ट्रेवल करना काफी कठिन है। तो जाहिर सी बात, ऑफिस में आना और जाना और इस तरह का बार बार आना एक कठिन कार्य है। हिल एरिया के अगर हम इसको मोबाइल ऐप पे ले आते हैं या कंप्यूटर से भी, क्योंकि नेट कनेक्टिविटी लगभग हर जगह है, तो बिना ट्रेवल किए आराम से कोई भी इसमें मैप अपना सबमिट कर सकता है, सैंक्शन करा सकता है। और अभी हमने एरिया में हमारे आए भी हैं और उधर भी स्टार्ट कर दिया इसको, काफी रिलीफ लोगों को मिला है। अभी एक और हमने स्टेप लिया है कि जो रेजिडेंशियल मैप के कुछ मॉडल मैप हमने बना के उसमें रखे। मॉडल मैप बना देने से क्या है कि आर्किटेक्ट्स के पास भी जाने की जरूरत नहीं है। जो लाभार्थी है, जो बेनिफिशियरी है, उनमें से कोई एक मॉडल अपना सेलेक्ट करके उस पर क्लिक कर सकता है और बहुत आसानी से अपना मैप अप्रूव उसका हम कर देते हैं। काफी ईज किया हमने इस चीज को लोगों को। आगे हमारा जो स्टेट जो अथॉरिटी का मास्टर प्लान है, उसको भी हम डिजिटाइज कर रहे हैं। जीआईएस बेस्ड मास्टर प्लानिंग हो रही है। तो जब मास्टर प्लान हम जीआईएस बेस्ड कर देंगे तो किसी के लैंड का खसरा नंबर उसमें अपलोडेड रहता है, उसमें डाल देते हैं, फीड कर देते हैं। तो घर बैठे ही कोई अपना मास्टर प्लान क्लिक कर एक क्लिक में जान सकता है मेरी लैंड की लोकेशन क्या है और उसका मास्टर प्लान क्या है। तो अभी हमने थोड़ा जो इसमें फेस किया था, कैपेसिटी बिल्डिंग का किया था कि अभी नया नया सॉफ्टवेयर आया था, तो हम लोग मिल नहीं पा रहे थे, दिक्कत हो रही थी। उसमें हर जिले में हमने एक आईटी प्रोग्रामर रख दिया है। उसका काम सिस्टम को चलाने के साथ साथ पब्लिक को हेल्प करना भी है। अगर किसी को नहीं आता या दिक्कत होती है तो वो उनको हेल्प करके मैप इसमें सबमिट कराते हैं। दूसरा, लगातार हमारा ट्रेनिंग इसमें हर डिस्ट्रिक्ट लेवल पे ट्रेनिंग कर रहे हैं। उसमें हमारे जो आर्किटेक्ट्स हैं उनको भी, जो ड्राफ्ट्समैन हैं उनको भी, जो ऑफिशियल्स हैं उनको भी लगातार इसमें कैपेसिटी बिल्डिंग करके काफी हद तक हमने समस्या का समाधान कर लिया है और सिस्टम हमारा गो थ्रू है काफी। दूसरी दिक्कत जो आई थी कोविड को अगर लेके हम देखें, जैसा मैं एजेंडा में देख रहा था कि जैसे किसी मैप सबमिट कर दिया तो साइट इंस्पेक्शन करने के लिए दिक्कत थी। वहाँ आदमी आएगा, फिर क्लोज कांटेक्ट में आएगा। वो एक हमने प्रॉब्लम फेस किया था कि उसमें हम सोच रहे हैं कि उसमें कुछ ऐसा गूगल का हम व्यवस्था करें, गूगल से इमेज लें और उसको देख करके और फिर उसका मैप सैंक्शन करने के लिए हम नेक्स्ट स्टेप उस ओर बढ़ रहे हैं, ताकि साइट इंस्पेक्शन के लिए भी न जाना पड़े और ऑफिस में बैठ करके गूगल का जो हम लेकर के सहयोग लेकर के और उसमें आगे की तरफ बढ़ेंगे। और मुझे लग रहा है कि ये हमारा काफी अच्छा है और इसका रिस्पांस भी काफी अच्छा आ रहा है। और बाकी तो यही है हमारा, ऐसा कुछ और नहीं।
Okay. So now I would invite Mr. Nakul S. He is a 2010 batch IAS officer with a very wide experience of administration. Basically, is DC Ballari, Karnataka.
हो गया?
So over to you.
So thank you, sir. Good afternoon to all the panelists. It's a pleasure to be presenting. I'll take a couple of minutes to elaborate on what we have done. The project that we have called is the Sandur Swayam Shakti Yojana. Basically, it is a scheme that says that in the taluka of Sandur, basically with the background is about a 2.5 lakh population taluka, which was one of the princely states of erstwhile British Empire, and they joined to the Indian Union late. And this is one of the biggest reserves of iron ore in Karnataka and of course in entire South India. So this area has large amounts of mining, and of course there were periods of earlier decade when there was a widespread of misuse of this iron ore mining, which led into a lot of issues. Now, as a effect of all this was that there was a large amount of mining being done, large amount of revenue being generated, including in the mineral fund, etc. But there was a heavy disenchantment among the public, particularly among the residents of that area, because there was that feeling of being bereaved of their bereaved of facilities, and also they had the feeling that a lot is being extracted from their areas and their lands, but not much is being done back to them. So this was one of the biggest issues of that area. And more importantly, slowly over a period of time, as and when the younger generation got educated and started to move in, they were educated as per the degrees, but they were not able to fit into the job, skill sets, etc. Many of them would be 10 and 12 pass outs, and then they would drop out from the higher education, but still would not be able to get any jobs because of the lack of skill sets. So we tried to target one particular group into it. Of course, we had different programs. The one which has been selected today is the Sandur Swayam Shakti. So the title itself says that the plan was to enable the localites of Sandur to gain employment by self-employment modalities and entrepreneurial skills to be developed. So we targeted the women group in Sandur Taluka to be skilled under our Sandur Swayam Shakti scheme. So this missing link of skill we try to pitch in by starting with an aggressive IC work in the village level. So our biggest problem in all our skill development schemes that we have seen is that many of them would not like to get although they would like to have the skilling to be done, but they don't attend the course because the training happens in a location which is far off from their places. So it is I personally feel also that it will be unreasonable to expect a daily wage earner in a village to be asked to travel 60 kilometers, get trained every day for 2 months and go back and have a wage loss as well as have a displacement issue. Even if you are able to provide some space to stay, they are not able to do because they feel it is alien to them to stay outside the village and kind of take up activities outside, especially for women. So what we did is we did aggressive IC activities in the village level. We roped in Gram Panchayat members and our agencies, government agencies also, and NGOs who went into Gram Panchayats, and each Gram Panchayat they conducted a one-day workshop on 2 activities. What are the skills that we wanted to train under this scheme? That is tailoring, heavy motor vehicle driving, computer training we have done, and masonry and electrician training is upcoming. So these skill sets we would be training them in the village level itself. So this IEC happened where we told people that, look, this is the skill set we are going to train. We are going to do it in your own village. So there's no need of you to worry about going to a far off place and staying outside or doing a to and fro journey. So we found a lot of traction when we said that we are going to do in the village level itself. Especially the women started to come in larger numbers. And once the workshops were over, we also did a workshop on how to have what are the entrepreneurial skills that they can develop, what are the opportunities in government schemes, etc., that they can kind of tap in and improve their livelihood. Once this IEC was done, we asked for a enrollment where we had set up a small software and computer, and our operators were sitting where people can come in and register skill development training at Gram Panchayat. So they basically didn't have to go anywhere. The entire scheme was going into Gram Panchayat to their doorsteps. So once the IEC activity was over, we had certain parameters of age and other. For example, we only did the women group for the first tranche, and age group was also shortlisted. So we identified a couple of training agencies as well as government agencies who could train them. So one of our biggest successes, two of them is primarily on tailoring and computer science, data entry operation. On the tailoring front, we have trained about 2060 as of date, 2060 women we have trained in the villages of Sandur at village level itself. And we have trained 1,137 persons, it is both men and women, on computer operation as well as basic financial accounting using Tally software, etc. We have also picked up on heavy motor vehicle. We are in the process of doing it for masonry and electrical skills training also. So the highlight of our scheme was that the skilling IEC happened at Gram Panchayat level. The skill training happened at Gram Panchayat level. So the feeling of Gram Panchayats, when I personally also traveled, is that people were very happy that the skill team itself is coming to Gram Panchayat. So there was a lot of traction for us, and a lot of people came forward in doing this. Even now we are in a backlog of about 1,800 trainings, because there are more and more women. The first batch got trained about 60 in each Gram Panchayat. Then the other women of the village started seeing that this is not any other Sarkari scheme, though, so there will be people coming in, there's an active participation. So they started to, other women also started to enroll themselves. So another thing that we actively did was to ensure accountability as well as transparency, and plus involvement of local representatives. So all our Gram Panchayat members and Taluk Panchayat members were also called in to look at the trainings. We had CCTVs and biometric attendance to ensure that attendances are done. And to make up for the wage loss, we also gave up a small amount of stipend was given to them so that they could make up for the wage loss that had happened. And one of the biggest attraction for the scheme was also the fact that whoever was able to attend the classes for about 80% of the attendance time, and also pass the test of stitching or computer test online, we gave them a kit. Basically, so for example, the tailoring trainees got a sewing machine, which we attended and got it out. So all this actually added more impetus to the training and also the enthusiasm of the women. So now what we have in turn done after the training is not to let go of them after the training, just train them and leave them off. So we have tied them up with local industries who have requirement of uniforms. And also we are planning to, post-COVID, we'll be trying, post-COVID when the schools open, we also intend to tie them up with schools and also government association, where a job work can be given to these women. It's not like training them, giving them a sewing machine and asking them to go home. So I'm very happy. My team just informed me that today the first batch of orders received from one of the big companies here, JSW, the uniforms are being supplied today. So, so we have got a 4,000 uniforms order. So they have just shipped the first batch of about 600 uniforms. So similarly, we want to take them forward also. And all the data entry operator and financial auditing or accounting trainees we have done, we have circulated the details to companies to try and hire them on the availabilities. And for the best of those well-trained ones, we are conducting the test, and the top 20%, we are distributing laptops to them using our own funds. So this is all overall what we have done, but I would just like to flag off that although this is only a skill training, what we have seen, especially among women, is a Cinderella-like transformation, because we see that women who were mild, timid, and they didn't venture out. They literally didn't know who are the other women of the village, apart from the people whom they used to get water with. So in this training, they were able to form groups and kind of tie up with each other, venture out for other things, and they were far more confident and more entrepreneurial skills were inculcated in them. So I believe this is what we have done, and it's been quite a satisfying, enriching experience for ourselves.
Very nice. Thank you so much, Nakulji. Madan Mohanji, I would request that, we need to keep to the time. since we have five more speakers to go, the time in hand is just about half an hour. So if
I think,
everyone is,
I would request them to combine it to 5 minutes.
5 minutes will be good, so that we have maybe 5 minutes of interaction left at the end. Over to you, sir.
Thank you. Now may I invite Dr. Akansha Bhaskar. He is a 2014 batch IAS officer, presently ADM Purlia, West Bengal.
Hello, sir. Good evening to all of the panelists and the guests. I am Akansha Bhaskar. I am Additional District Magistrate of Purulia District, and I'm here to talk about our labor information system, which we call Vishwakarma. Now, as you all know, this year we have been going through one of the biggest humankind disasters, and as a result, because of these migration of the unskilled laborers, the semi-skilled and unskilled laborers from various parts of the country, our district also saw the influx of around 60,000 laborers, and we suddenly realized that this is not only stagnating the industrial momentum, but it is also causing huge skill displacement without any clear feedback or data of where the skill will go in the future. So we made this labor information management system. As you know, any sort of labor information management system is heavily used in our country or across the world for the formal sector. We have LinkedIn, we have Naukri.com, but any type of structure is missing for the informal sector, which forms the bulk of our economy. So we made this portal. It is self-maintained, it is open, it is completely transparent. Here you can the industries or the job providers, even individual job providers, can place their demands, and the laborers can look at the vacancy in their area and apply for the same. As soon as we launched it, L&T was our first big order. They already placed a demand of 10,000 laborers. Not only the private entrepreneurs, we also got demands from various line departments, engineering departments like physical health engineering, public health engineering, public works departments. So a lot of stuck projects during the lockdown period, which was stuck because of lack of labor movement, they started because of this platform. And the source code for this platform was requested by the government of by some district administration in West Bengal itself, district administration across in other states, in Chhattisgarh, in MP. So I would say that it is easily replicable. The impact is huge. And one thing that I am really proud about from the side of our team and the team of NIC that helped us with this is that we did not have to depend on the IT literacy of the workers, because we have something called Bangla Sahayata Kendras at every small district block administration or Gram Panchayat administration in our district. So even if the workers who couldn't use the IT, who couldn't create their own profile, who couldn't look at the vacancy, they can go to each Bangla Sahayata Kendras and their profile would be created for them. And any news of any new vacancy in near about districts or near about their place of residence will be sent to them via the SMS. And I think that was a very small but unique innovation that helped increase the outreach of this program to a huge number of people. So I'm glad that SKOCH has given us this platform to talk about our this portal, and it has been an immense learning experiences from the experience sharing that has been done from other district administrations and institutions. Thank you so much. It was a huge honor being here.
Thank you, Dr. Bhaskar. Now I would request Dr. M.V. Reddy, who is a senior IAS officer of 2007 batch and a very long experience of administration and development. He is currently collector and DM at Kottagudem district, Telangana. Sir, over to you.
Yeah, good afternoon, Madam Mohanji and coach team and all the panelists. Mission Badram Badradri. Badram means in Telugu language safety of our district. So our district people. We coined that, our team have brainstormed. Our first case was spotted in March on 12th. Visitor from Italy, our journey started quite before lockdown. Our district is a very, very has a lot of challenges. It is a tribal district, agency district, 2/3 of the population, tribal and SC population, and 1/3 of the illiteracy, and also 80% of the poverty, surrounded by 2 states and 3 districts of Telangana, and interior habitations, almost 1,250 habitations, interior habitations. Then it is all compounded by 2 months of unprecedented Godavari floods. Several villages are inundated and communications are disrupted, and also a spell of 2 spells of heavy rains. So they have compounded our challenges to contain this COVID. Keeping these 3 aspects, convergence, technology, and also people's participation, I'll be presenting. So we have brainstormed our team, all stakeholders. We got together already in our district every Monday. We have all districts, all departments meeting is there. It's called CRM, Coordination Cum Review Meeting, every Monday 4 noon. So in those issues on that platform, we'll be discussing, also coordination issues we'll be handling. So that platform has become a very handy for us. And then we have further strengthened. Then we have debated our risk factors of our district. And then what should we do? Then we coined Mission Bhadram Bhadradi. And our 7-pronged strategy is first aggressive IEC through all platforms, not only in the media, but also all available platforms. We have coined MUST campaign. So MASSSTH, MUST campaign. It's so that people, our team public remembers, MUST is, M is mask on, A is for always remain in aeration areas only, don't get locked in the ill-ventilated areas. Then social distancing, avoid social gatherings, and testing, aggressive testing, tracing and treatment, and hygiene, personal hygiene. So these were the main components of our MUST campaign, IEC campaign. Then the next item, what we have done is then the stakeholders meets, like the street vendors, shopkeepers, the medical shop persons, then all the women self-help groups, stakeholder platforms we have identified, and then we started stakeholders consultation. That has really helped us a lot. And then also we have identified these industries. Our district is having a large mining, Singareni coal fields, then power generation, and also paper industry, and industrial engineering goods industries. So a lot of in-migration, out-migration is there. That is also another risk factor in containing the COVID. So keeping all these things, we have negotiated with all these industrial groups and also frontline workers, self-help groups. We have had a series of meetings with them. And then we have given a lot of importance for active surveillance at not only in government hospitals and also the private hospitals, at medical shops and across the tribal habitations, by even mobilizing the mobile labs, mobile healthcare ambulances. We have engaged, and because of this testing, aggressive testing, the 4th aspect, we have tested almost, as of now, 25% of our population we have tested in order to trace the positive cases so that we can promptly isolate and then resort to treatment. Then intensive tracing, isolation, and quarantine. And the 6th point is the prompt treatment, not only at home by delivering the treatment kits at these tribal habitations or wherever it is required, but also healthcare facilities. We have strengthened 3-tier healthcare facilities. Earlier, before COVID, used to depend on Hyderabad and Warangal for referring our patients, treatment of COVID patients or other emergency cases. Now, we have strengthened our 3-tier at mandal level, that is village level, major village level, area hospital and district hospital. Now, as of now, we have got 50 beds, oxygen supplied beds, intensive care units. We are self-sufficient. Our people are not going to Hyderabad or Warangal. Now we are able to handle in our district only. And another important thing what we have taken up is the corona is not a health department mandate alone. Total sanitation drive we have taken up. We have converged all the departments, municipalities, panchayats, then women and child welfare departments, all other departments were including health department. So total sanitation drive, out of that 5-point strategy: total cleanliness, proper drainage, proper waste disposal, proper disinfection, decontamination, and vector control measures. Because of this, we are not only able to control corona, but also seasonal diseases have significantly reduced. Not only malaria, dengue, chikungunya, the TB, common flu, these diseases are, they used to bother our agency district, tribal habitations a lot previously. But because of this, we are able to control these seasonal diseases also. Now, I would like to, the outcomes, now, of course, in our presentation, it is there. Now, before lockdown, 1+3, 4 cases only we restricted. Our district remained almost during the lockdown, entire lockdown period, no cases were reported. We are very, very meticulous with all our surveillance team, multi-facility approach. 2.5 months, it remained in the green zone. But only after lockdown, as I explained, because of the lot of in-migration, because of lot of migrant workers from other states, not only technical people, skilled people to work in these industries. So because of them, the corona has come and then the cases have increased. Because of that, we increased our aggressive surveillance, testing, and hospital facilities. We are able to deal very comfortably. Now, the positivity also reduced now, as on now, 3%, and the recovery has increased to 94%. Now, we are very, very self-reliant in our healthcare facilities and also mobile testing also. The mortality rate is 0.6%, and I must say with regrets that one of our frontline worker, Deputy District Health and Medical Officer, Dr. Naresh, while before COVID lockdown, while striving his best to protect the people, he himself contracted the disease, he succumbed. So he's our monitor. So that also further added our fire to our mission Bhadram Bhadradri. Seasonal disease.
We'll come back to you, sir.
Yeah. No, 3 points as far as the. Okay, then I will wait. Yeah.
Okay. Thank you very much.
Thank you.
Dr. Reddy, he has just told us how he made convergence and participation of the people possible and met the challenge of COVID. Thank you very much, sir. We'll come back to you again.
Thank you.
Time permitting. Now I would invite Dr. Hari Jawaharlal Mundaji, a very senior IAS officer of 2005 batch. He has been DG, Director of National Center for Good Governance, and he has been awarded for good governance in aspirational districts. Presently is DM Vizianagaram. So may I request Dr. Munde to please put
Sir, good evening, sir. I am Dr. Hari Jawaharlal, sir, District Magistrate of Vizianagaram District, sir. Vizianagaram District is one of the aspirational districts in the country. It is one of the, remotest district to the capital. And the total population is 24 lakhs. Sir, the first thing is we could able to win over this corona time because of three important things. One is complete awareness, total awareness, public awareness. That is the most crucial, challenging thing for the district administration. And the second one is the strategies evolved from time to time. During lockdown time, one strategy. After unlock time, some other strategy, and present there is another strategy. Like that, every time we used to change the strategies. That is second important thing I wanted to tell. Then third one is the strategies worked out for treatment purpose. These three are most important things I wanted to tell. Particularly the management point of view, the administration point of view, we have evolved a 7-step strategy. In that, the strict surveillance is one important task. We have entrusted to the medical and health department, all other volunteer system, Gram Sachwalaya volunteers. Then second strategy is quarantine strategy. Strict quarantine is there. The first case registered in Andhra Pradesh is on 19th March, whereas in Vizianagaram, almost after 2 months, the first case was registered. The reason for that is we could able to keep very strict quarantine mechanism in the district. Then third one is logistic arrangements, essential commodity strategy we have worked out for all the people during the lockdown period. And the fourth one is sanitation strategy in urban areas, separate strategy, and also rural areas we could able to develop a separate sanitation drive during this lockdown time and also unlock period. Then migrant labor strategy, almost 9,000 people were, migrant labor was, stopped in this, during COVID time. We could able to, take over their, health and also their day-to-day things. Then a strict containment strategy with the police department and other departments, we could able to have during lockdown period. Then last strategy is, treatment strategy. We could able to do treatment at 3 places. One is at home isolation treatment, and the second one is a COVID care center treatment, and then third one is a hospital treatment. See, here also the home isolation for wherever the facilities are there, we could able to keep them in their own houses, but we have not neglected them. And every day the ANM is to go and see the protocols. Similarly, COVID care center, wherever the possibilities are not there, the poor people are not able to keep them under home isolation, were shifted to the COVID care center. Wherever the asymptomatic cases are there, kept in COVID care center. Then wherever the cases with symptoms and comorbidity cases, as well as the age group, whichever is more than 50 years age group, irrespective of gender, we could able to shift to the hospitals. Because of the shortage of resources, we have divided this kind of strategy for especially for treatment part. So likewise, these 7 steps worked out very, very effectively, that yielded the results in Vizianagaram. The entire now the positivity rate is 0.6, and the lowest death in the entire state. Almost 40,000 were affected. Only 2,207 people were died, and the doubling rate is 2,745 right now. And the present cases are single-digit cases. Only 4 cases are there out of 3,007 testings, and the recovery rate is also 98%. And here I wanted to tell one thing. One is the greatest challenge is awareness building. Here we could able to develop a 10 commandment strategy. Very simply in Telugu, in vernacular language, we have prepared a pamphlet wherein Mutiki Mudu means for face, 3 things are very essential. That is using mask, and taking homeopathic, arsenic alba tablets. And then third one is taking nutritious diet during COVID time. These three things are for face purpose. For hand purpose, there are three things are very important. One is hand washing, and then second is downloading the Arogya Sutra for smartphone people and using the YSR telemedicine wherever that is, where the facilities are available. Treatment, where will you get the treatment? And these three things are used for the hand purpose. One aspect is for leg, that is keeping social distance for 6 feet or 2 meters, that is a mandatory. And then Baitiki Modu, external things are three. One is, don't listen to any, social media where the, there is no professional, things are there, not to be, listen to them, and keeping the premises clean. Then third one is early detection, not to fear, for early detection purpose, wherever you are having some kind of breathlessness or fever or sneezing, cough, then immediately go for testing, and early detection is the key point for immediate treatment. These 10 commandments is worked out very well. For here, I wanted to tell one thing is cooperation from public representatives, very much involvement of the civil societies and the community-based organizations, self-help groups, as well as the NSS. Entire community was involved in creating awareness among the public. That is the, I can say, out of 100 points, 60 points is only for IEC activities and creating awareness among the public. And the remaining 20% is for convergence and convergence of all departments. That is also yielded very good result because of all of them are same and doing only medical and health work. This is the second important, positive thing in our district. Then third one is, this kind of strategies from time to time, changing the strategies, and then watching whether the things are going in right direction or not. For that, we used to conduct, death audits also. Who are dying? Why they are dying? For that, some intelligent group consisting of all kinds of all professionals are there. They used to give time to time, some kind of inputs from the professional group. That also yielded very good result. This is the this is what I wanted to tell from Vijayanagram, sir. Thank you.
Thank you very much, Dr. Jawaharlal. I think you have already said very good strategies were deployed in terms of convergence and cooperation from different departments. Now I would request Mr. Dinesh Jain, who is a 2011 IAS officer, MP cadre, and presently DM Shajapur, to please give his views. I understand you have handled a variety of good governance projects. So over to you, Mr. Jain.
Good afternoon, sir, and all the panelists. I am Dinesh Jain. I am presently DM in Shajapur, Madhya Pradesh. Sir, actually, during this pandemic, when it started from March, there was a system in Madhya Pradesh in all districts. We had a Jan Sunwai system, and every Tuesday, people from all the district came to district collectorate office, and the district collector and other officials of the district, they listened to their grievances and try to solve them. But after this COVID pandemic, it was not possible for the people to come from the villages to the collector office or to the district headquarters. That's why we thought why we should go to them. So that's why we plan a system, because this all the e-governance systems which we are doing from this VC. Upper side, it is very usual now from 10 to 12 months, we are using this system from state to the district. But I want to create this system downwards also for the Gram Panchayat level. People from the villages, they can also participate and try to resolve their problems through us. We can connect to them simultaneously, because public transport system was also not available at this time. And those who don't have their private vehicles, they are not able to come to the district headquarters. So that's why we plan this, and we have 326 gram panchayats. We take 12 gram panchayats at a time. We disclose this very much before. At the beginning of the month, we declare these 12 panchayats will be heard at this day, every Tuesday from 11 to 2 to 3 p.m. I and my district officials, they sit in the collectorate office, and we connect to each and every panchayat. At the panchayat and gram panchayat level, common people, sarpanch, gram panchayat sachiv, gram rozgar sahayak, and all these, some government officials, private people also, females, handicapped persons, they gather in the gram panchayat. We have a system called e-daksh in our gram panchayats. We have a computer systems and network facility there. So we connect to them and try to convince. Actually, if anybody come to district collector, always it is not possible ki he can meet to me or my district level officers. We are not always available, or we are in some meetings. So this platform gives a opportunity to the village people, gram panchayat level, ki they can say directly to the district magistrate, they can talk to the collector, they can, anybody can uh, say anything regarding village development, regarding their personal problems, regarding some complaints to the panchayats or others. So this is a very good platform which we are using. Village people are directly telling most of them. We can also assessing the schemes which the government is implementing in those places, what the villagers feel about these schemes, are they getting the benefit or not. So it is a one-to-one system which is working very good. Direct feedbacks of the government schemes, and we can also give directions to village people also directly. If in the COVID we were asking our at the village level, masks are going to be used or not, so we get direct feedback from them also. And the people gather, they if they are wearing the mask, then we can judge ki yes, they are following some norms. So we can also, if we want to tell something regarding our schemes, regarding some recent instructions, so we can directly tell to them. Our officers at the district level, some electricity department officials, health officials, public health engineering officials, and other Jilla Panchayat level officers, all are at the district office. So when anyone describe their grievance regarding their departments, they directly either they can reply to it, or they note down it and try to solve and give a satisfactory answer to the public key, and they are trying. So we get the real situation at the ground level from this system. Our Digital India program up to Gram Panchayat level is working very well. Generally we get most of the complaints we get ki this scheme is not working properly, or in our PDS system, our some people are not getting their food coupon, etc. Either their electricity connection is not going to be, they applied earlier. So these small things can be solved immediately without they have to come to my office. It is a very the infrastructure they have at the village level. The people, when they are combined, they suggest that this building should be used for this, or some drinking water scheme is there, water storage tank is there, but water supply line is not there. Then they say ki why you plan this scheme. Means people are evaluating the schemes of the government. They are suggesting what should be done on priority, what should you do for regarding roads. So we are taking their suggestions because they are the main stakeholders of any scheme. They know better than our officials where the road should be built, where this water storage tank should be built, where hand pump should be dug. So these things they are means participating in scheme implementation and scheme planning also they are participating. Common people, those who are handicapped, those who are
We'll come to you,
old
sir.
people.
We got it.
Thank you, sir.
We'll come to you again.
Thank you, sir. Thank you for this opportunity. Thank you.
Very good presentation actually. People's participation, how you have ensured and how you have been in touch with the last mile people, no, in the last mile.
Thank you,
Good.
sir.
So may I now request Mr. Surinder Singh is there, our colleague?
Yes, sir. Yes, sir. I'm here, sir.
Okay, how are you?
Fine, sir.
Would you like to add something, sir?
Yeah, definitely, sir. It's a good opportunity for all of us to hear directly from the district magistrate and district collectors what is happening on the ground. Since district administration is the only key government functionary which actually disseminate the benefits of government schemes to the general public. So, as we have seen, just heard several examples of good coordination among other several departments. As Dr. Reddy has mentioned that state government, municipal corporation, industrial groups, self-help groups, they work together in COVID situation to take care of health and testing facilities and manage sanitation drives, which should not only control corona but also help to general public for to save themselves from the seasonal diseases as well. So good coordination among different departments will always result in very good system as a whole. I would like to just give one information that Niti Aayog has also taken 117 transformation of 117 aspirational districts, and they have adopted three principal programs. First is convergence between central and state government schemes, and then collaboration among citizens and functionaries of central and state government, including district teams. And Niti Aayog has created a competition among the districts. So they are using 5 main themes to judge the performance of the districts. And they are like health and nutrition, education, agriculture, financial inclusion, and skill development and basic infrastructure. So if the district administrations could be judged based on some parameters all over India, so then the performance would also get increased over a period of time, since the district administration already it started getting integration among various stakeholders. So I think then a bigger platform would definitely help to bring out more efficiency in their system, where as far as the coordination among various stakeholders is there. Thank you, sir.
Thank you, Mr. Su. I forgot to tell, he has been a former advisor in the Niti Aayog, among others.
Yes, sir.
Sir, one small question to all the panelists rather. I would start with Mr. Reddy. And sir, whatever we have achieved so far, you see, whether in terms of cooperation from different departments or people involvement or upscaling of technology. So the thing is, how do we take it forward? How do we make it sustainable? In some quarters, they are telling that it is more out of fear of COVID that we have come together. No, when there is no course left, we come definitely in the hour of crisis we come together. But how we'll take it forward and how we'll make it as a system? Any views on that? I'd request Dr. Reddy to first say and then maybe one or two comments from others.
Thank you once again. COVID initially we were fearing very much, but that has taught us many lessons. And especially we have learned to, the art of convergence. The health is not health department alone the task. Various departments, including the ground level people's participation is very much, it has to be ensured. Otherwise, we cannot ensure health. That's how, I would like to stress upon here that the act of simple weekly convergence meetings at district level and also at village level, various stakeholders, regular meetings, that has become a system. I think it cannot be ignored. Everybody has seen the benefit of these convergence meetings at various levels. Then we have also these platforms available at ground level, the self-help groups, the farmers groups, then panchayat, municipal councils, regular debate with them, especially the women self-help groups in district like in our Bhadradri district, more than 90% of the families are members of that group. So we have recognized the potential of that. We have intensely taken up IEC on this platform. So that we will continue. Then the technologies, the technologies, the Zoom VC, we are able to, because of the Corona, Zoom video conference, we used to conduct up to mandal level with almost hundreds of people. And the group top teleconference, we have realized, and almost 1,500 people at a time, up to sub-bench level, village level, we are used to, talk to them. So this system we can't ignore. We have already seen the benefit of this and the cost-effective, time saving. So they will continue. They will continue the systems. Then the decentralized testing in healthcare in district like in agency district, they will continue. We have seen the benefit of them, and the people also have seen the benefit of it. They will continue. So no question of U-turn again. They will continue definitely. So like that, there are several, maybe because of the time paucity, I will not be able to, take much time. You are willing to talk to other people also. So the WhatsApp technology also, every department we have created WhatsApp group. District officers, WhatsApp group is there. Day-to-day basis, we have been communicating with them, and they used to, get the feedback and then whatever instructions. We used to WhatsApp platform, simply sitting in our offices at our homes. We are very much used for that WhatsApp groups also. Thank you very much. Yeah.
Thank you very much, sir.
Yeah.
For your nice views.
Thank you.
Anyone, one comment more we can have, if anyone would like to give on this in this regard. So, gentlemen, if there are no comments, then I would really like to thank.
आसनसोल म्युनिसिपल कॉर्पोरेशन.
हाँ, आप कुछ कहना चाहेंगे सर? Would you like to add something?
Puresi told us for calling.
Hello.
Sir, Mr. Puresi told us for calling Asansol Municipal Corporation.
Okay, you just wait, I think. So friends, thank you very much. it was a very nice participation and very good views have emerged. And in fact, you have given us a lot of confidence and assurance that this is not a one-time affair. It will be a continuous process, because we have seen gains and we have visualized the gains from it, not only for COVID, but for other development purposes also. So thank you one and all on the panel.
Well, Madan Mohanji, this was really very nice. In fact, a lot of new piece of information, a lot of new learnings that have come through this discussion. Thank you so much for very efficiently steering it through and getting them to speak. Sometimes it so happens that the thoughts are sitting there, but they're at the back of your mind. Somebody really will have to go and kind of encourage them to speak. I think that job is very well performed. Thank you so much for helping us conduct this session, and thank you all.
Pleasure is mine.
You're welcome. Thank you all the panelists.